Bonnie is a 90-year-old woman with impaired balance resulting in multiple falls, 2 of which required hospitalization. She lives alone in an apartment and has a home health aide 3 days a week to assist her with shopping, cooking, and cleaning. Her main concerns relate to maintaining her physical and cognitive function so she can remain in her apartment, and to reduce her falls. Like many older adults, Bonnie has age-related changes in motor, sensory, and cognitive systems. Range of motion is limited both actively and passively in her arms and legs. In addition, she has reduced spinal flexibility, which reduces her ability to rotate her trunk. While Bonnie has good strength in her upper extremities, her lower extremity strength is reduced. She's able to move against gravity, but has reduced ability to take any additional resistance due to strength limitations and pain. On the finger-to-nose test, her movements are slow, and she has an irregular trajectory and reduced accuracy. Researchers have found impaired multi-joint coordination in many older adults like Bonnie. Age-related changes to vision include reduced contrast sensitivity, problems with depth perception, shown here, and reduced visual acuity. Somatosensory changes include reduced vibratory sense, proprioception, and light touch, tested here by asking Bonnie to close her eyes and report if and where a light touch is occurring. Like many older adults, Bonnie has some cognitive deficits, including problems with short-term memory and mildly impaired executive function, which affect her performance on tests such as the trail-making test. Bonnie has significantly impaired balance. She falls several times a month, most often when she's standing unsupported, leaning over to pick something up, or when walking. She has difficulty with steady-state balance control in standing, but not sitting. While she's able to stand unassisted without her walker, she requires close supervision. Bonnie has impaired reactive balance control. In response to small perturbations, she uses her arms and requires assistance to recover, and is unable to take a step in response to a larger perturbation. Bonnie has reduced proactive balance control. She uses her arms when moving from sit to stand, requires multiple tries to get up, and needs assistance to stabilize. She reaches only 4 inches on the functional reach test and requires assistance to maintain stability, confirming her increased risk for falls. She is unable to lean over and pick something up from the floor without physical assistance. She has fallen several times at home picking things up from the floor, even with her walker. On the modified clinical test for sensory interaction and balance, Bonnie requires close guarding when standing on a firm surface with eyes open. She is unable to stand on a firm surface with eyes closed or on the foam surface with eyes open. Research suggests this is due to both sensory impairments and central deficits in organizing sensory inputs for balance. Difficulty with walking and other mobility skills is also a characteristic of balance-impaired older adults like Bonnie. Bonnie is unable to walk without her walker. Gait velocity on the 10-meter walk test is 0.4 meters per second, which is too slow for safe community mobility. Her gait is characterized by a shortened asymmetric step length, reduced foot clearance, and increased step variability. Slow gait velocity and reduced step length could be the result of weakness in the plantar flexors and hip flexors, or a compensatory strategy to improve stability. Researchers have found reduced muscle activity underlying gait in balance-impaired elders and increased coactivation of agonist and antagonist muscles, which many believe is a strategy to improve stability when walking. On the timed up-and-go test, Bonnie must use her arms to get out of the chair. Her walking speed is slow, and she has difficulty on turns. She completes the test in 26 seconds, considerably slower than most healthy older adults. Adding a cognitive task to the tug results in an even slower time of 33 seconds, with multiple errors on the secondary task. Bonnie has difficulty completing complex walking tasks such as obstacle negotiation. She can't lift her walker over the obstacles, which has resulted in several falls in the community. As we age, we often develop problems with reach, grasp, and manipulation. On the Jebsen-Taylor hand function test, Bonnie moves the cans quickly, showing no difficulty with reach and grasp. Bonnie has no difficulty picking up and stacking checkers. However, despite repeated instruction and demonstration, she was unable to follow directions to complete the task correctly. Researchers have found that precision grip control declines with age. Possible reasons for this include decreased sensation in the fingertips and a reduced ability to accurately program forces. Age-related decreases in manual dexterity become apparent in tasks such as writing, tying shoelaces, and fastening buttons. The time needed to complete these types of tasks increases significantly with age. Practice can reduce, though not eliminate, age-related changes in reach and grasp skills. Bonnie is a 90-year-old woman with significant balance impairment resulting in recurrent falls. She has age-related changes in motor, sensory, and cognitive systems. She has reduced range of motion in the trunk, arms, and legs. She has impaired strength, primarily in her lower extremities, and is able to take only mild resistance. She has coordination deficits on the finger-to-nose test. Her movements are somewhat slowed and inaccurate, and she has mild tremor at end range. Bonnie has multisensory deficits, including a sensory neural hearing loss, reduced vestibular function, and impaired vision, including reduced contrast sensitivity, visual acuity, and depth perception. She also has impaired somatosensation, including light touch, vibration, and proprioception. She has mild cognitive deficits affecting memory and attention. She has impaired steady-state balance in standing, requiring close supervision. She has kyphosis and a forward head posture. Bonnie has impaired reactive balance and relies on her arms to recover stability in response to any perturbation. On the push and release test, she cannot take any resistance and therefore falls in the direction of the push. On sit to stand, a task requiring both proactive balance and strength, she uses her arms and needs assistance to stabilize. She is able to reach only 4 inches on the functional reach test and requires assistance during reaching. On the clinical test for sensory interaction and balance, she's able to stand for 30 seconds on a firm surface with eyes open, but requires close guarding. She is unable to stand on a firm surface with eyes closed or on a foam surface with eyes open. Bonnie is unable to walk without a walker. Her gait velocity is 0.4 meters per second, not fast enough to be a community ambulator. She completes the timed up-and-go test in 24 seconds, requires her hands to get up, and is unsteady on the turns. With the addition of a cognitive task, it takes her 33 seconds to complete the tug, showing the effect of a secondary task on walking. Bonnie has appropriate reach and grasp and completes the moving cans test with minimal difficulty. Bonnie has minimal difficulty picking up and stacking checkers. However, despite repeated instruction and demonstration, was unable to follow directions to complete the task as directed. She has difficulty with fine motor coordination, due in part to peripheral neuropathy and reduced fingertip sensation.